Let's talk about the nerve supply of the dura mater. So, dura mater is going to be supplied by the 5th cranial nerve and the 10th cranial nerve, namely the trigeminal nerve and the vagus nerve. And it is also going to be supplied by the sympathetic trunk. The sensory nerve endings are sensitive to stretching. They are going to produce sensations of headache. If there is stimulation of the sensory endings of the trigeminal nerve above the tentorium, then there's going to be referred pain to the area of the skin on the same side of the head. And if there is going to be a stimulation of the sensory nerves below the tentorium, then the referred pain is going to be towards the back of the scalp, the back of the neck, and along the distribution of the greater occipital nerve. Now let's talk about the arterial supply of the dura mater. Arteries are going to come from VIMA. So here I have a mnemonic for you guys. Vertebral arteries, internal carotid arteries, maxillary arteries, and the ascending pharyngeal artery. But the most important from the clinical point of view, we have the middle meningeal artery, which is present in the intratemporal fossa. Here is the middle meningeal artery. So she has to enter the dura mater. What is she going to do? Let's help her. First of all, she has to enter the foramen spinosum. And from the foramen spinosum, she's going to enter the cranial cavity. Now she is going to be present between the two layers of the dura mater, namely the endosteal layer and the meningeal layer. But she has to go someplace else. Let's see where. So she goes forwards and laterally in a groove on the squamous part of the temporal bone. And here she is going to bifurcate and divide into anterior and posterior divisions. So the anterior division has a shovel and it is going to form a deep groove on the temporal bone from the antero-inferior angle. And now she is going to be close to a place. And this place is the 3 central gyrus of the brain. And what is her posterior branch going to do? Her posterior branch is going to curve backwards and it is going to supply the posterior part of the dura mater. In the endosteal layer lies the meningeal vein. So this is the outer layer and here the meningeal vein is going to be present. Middle meningeal vein is going to follow the branches of the middle meningeal artery and it is going to drain into the pterygoid venous plexus or the sphenoparietal sinus or the SPS. Veins are lateral to the arteries, so that is it.